My name is Werner. I'm a podiatrist. I've been practicing here for 6 years in Fort Worth. What I really enjoy is when you help somebody in a way that they're now able to do something that they've loved that they haven't been able to do for a long time. And more particularly when it comes to arthritis specifically of the big toe joint. When they're not able to walk, when it's incapacitating, and whether it's from gout or from arthritis or wear and tear, and they can't do what they truly enjoy, whether it's with their family or their kids or their sports or their golfing, or I have some that were in ballet and weren't able to do that anymore, and then we're able to help address that pain on a custom approach depending on that patient, and able to get them back into activity. That was very rewarding. That's something I really enjoy. And particularly I like replacing the joint of the big toe joint so that they're able to have more motion that they weren't able to have before, and able to do more activity than they were able to do beforehand. There was a patient that she wasn't able to dance anymore, and she just wanted to go two-stepping and at Bob's downtown in the stockyards, and she wasn't able to do that anymore with her boots on, and we're able to address the problem. She had arthritis in her big toe joint, able to replace it, and she was out dancing again and happy as a clam. That was really rewarding, one that I remember. There's several others, but that one stuck out to me because I personally like two-stepping myself, and wearing boots. If I saw someone limping, and something that I want them to know would be that could cause other problems in their other joints, such as their knees and their hips, and sometimes just addressing the foot, which is the foundation of their body, it could help alleviate a lot of those other issues that they may have or that could come about. And with something as simple as orthotics that I personally had in my own life that prevented those problems. So working somebody up from coming in with just foot pain and they're hurting, and then that's causing them to limp, we'd probably first start with where their pain is located, how long they've had it, what kind of pain it is, just kind of a generic approach at first before we dive into more of a sniper approach. So letting them tell the story of how this happened, what made it worse, and what makes it better, and then maybe getting x-rays depending on if it's really bone related or soft tissue related. And then we talk into what are some things first off that we can do conservatively to help this, and go from there. We may have to get more advanced imaging, but trying things with a conservative approach first before going surgical route is generally what I tend towards. I try to treat people like my family's being treated. Like I'd want to treat them like how I would want to be treated. And like what prevents me from wanting to even go to see the doctor is them maybe having a money agenda, or because I've seen it unfortunately, or having a plan already set in place that's generic for everybody, and they're not going to listen to me, to my own problem, and that's something that I would have a problem with, and always having me come back to the office even though I'm not making any progress, and expenses just keep wrapping up, and that's wanted to keep me away from the doctor many times. And that's something I'm really passionate about doing, is not having someone come back for no reason. Like, we want to address the problem the first visit and get to the root of it as soon as possible, and not wait until everything fails and then finally order an MRI, and then really get to the root cause. It's addressing everything right away that I think is important for saving money and would keep patients happy, because that would be something that'd keep me happy. And then and trying to make them enjoy their life after that.